PEP is a flow-operated positive expiratory pressure device used to assist with chronic sputum retention, reducing gas trapping and improving lung ventilation. It should be prescribed by a healthcare professional trained in the use of the device. PEP therapy is believed to improve secretion clearance by splinting open airways prone to dynamic compression during forced expiratory manoeuvres, and improving ventilation and gas flow through recruitment of collateral channels and enhancing expiratory flow. There are two PEP devices. The PARI System 1 has 5 parts: a mouthpiece, a body with a manometer port, an upper part with resistor holes, and a nose clip. It is assembled by placing the mouthpiece onto the body. The upper part is then placed on the body with the correct resistor hole lined up with the large hole on the body. When a manometer is used, the body is replaced by the alternate body with the manometer port. If it is used with a nebulizer, it connects with the PARI LC+. The PEP S has 5 parts: a mouthpiece, an inspiratory valve, a connecting body with a manometer port, an adjusting ring, and a nose clip. It is assembled by placing the mouthpiece onto the connecting body. The adjusting ring slides over the body so that the correct resistor hole lines up with the large hole on the body. The inspiratory valve is then attached. If it is used with a nebulizer, it connects with the PARI LC Sprint or Sprint Star with the inspiratory valve removed. If bronchodilators have been prescribed, administer them before commencing treatment with this device. A nose clip may be used when teaching the technique to minimise the loss of airflow through the nasal passages, but due to discomfort, they are not often used for continuing therapy. If appropriate, these devices can be used with a mask. The PEP device is not position dependent but is generally taught in sitting. Sit with the arms supported, with a neutral lumbar spine and the shoulders and neck relaxed. A manometer may be included in the circuit for training purposes to ensure adequate pressures are generated and to prescribe the whole size. The positive expiratory pressure resistance is selected according to the clinical symptoms. Common sizes initially selected for the teaching session are 3.0 or 3.5. Seal the lips around the mouthpiece. Breathe in with a slightly larger than tidal volume breath. Breathe out actively but not forcefully through the mouthpiece, maintaining a steady PEP of 10 to 20 centimetres of water pressure. If adequate pressures are not achieved, alter the breathing pattern or the hole size until PEP pressures of 10 to 20 centimetres of water pressure are achieved with good expiratory flow. The correct hole size is the one that can achieve this with the least effort. Once the hole size has been prescribed, remove the manometer attachment and change the body of the device. For the PARI S, the manometer is removed and the cap is placed on the outlet. Check that the patient can cope with the number of prescribed breaths. This may range from 6 to 12, depending on the individual's sputum volume, fatigue, and dyspnea levels. This is 1 cycle. Breathe quietly until ready to commence the next cycle. The physiotherapist will prescribe the number of cycles, which will depend on the clinical symptoms. When using this device for airway clearance, huff as instructed by the physiotherapist either at the end of each cycle or at the completion of all of the cycles. This should be individualised to the patient's needs. At the end of the session, dismantle the device and wash all of the parts in warm soapy water. Each week, disinfect the device as per the manufacturer's instructions. The patient should be given written instructions including the technique, prescription, and cleaning of the device.